3 people are dead and at least 3 others sick after a suspected outbreak of hantavirus on a luxury cruise ship. The ocean-wide expeditions vessel was traveling from Argentina to St. Helena and is now anchored off the coast of Cape Verde, Africa. Roughly 150 people are still stuck on board, though evacuation efforts are underway to extract 2 showing symptoms. The WHO stresses the risk to the public remains low, and there's now no need for panic or travel restrictions.
With more, we are joined by Dr. Anne Ramoyne, director of UCLA's Fielding School of Public Health Center for Global Health Security. Dr. Anne, good to see you. Let's talk about hantavirus itself, something that came to a lot of folks' attention last year following the death of Gene Hackman. What is hantavirus? How does it spread? And what symptoms should folks look out for, especially early on?
Well, thanks for having me. Here we are talking about hantavirus again. This is a family of viruses that are carried normally by rodents. And people usually become infected when they breathe in particles from rodent urine or droppings or saliva, especially when contaminated dust is dispersed when people are sweeping or cleaning out areas that are dusty. So this is normally where you find it. We've had cases of a hantavirus in the United States. We've talked about this. We've had it in Four Corners area. We saw this with Gene Hackman's wife. New Mexico had cases in Yosemite. So this is not completely abnormal to see a case, but we've never seen a case on cruise ship.
Right. So hantavirus is not typically associated with cruise ships, as you mentioned. So what would you attribute this specific outbreak to?
Well, we're at the beginning of this. We don't know what it's actually attributed to. Here's what we know about hantavirus. Hantavirus is usually spread by rodents, and most of these hantaviruses are not very transmissible from person to person. However, there is a strain that's in South America, the Andes virus, which is often found in Argentina and does have the possibility of spreading from person to person. So we have a lot of questions here, right? We need to know who got it first. Where did they get it? Did they get it before they boarded the ship? Did they get it on the ship? Did they get it while they were disembarking in one of the places that they were at? Was it from rodents on the ship? So there are a lot of questions that still need to be answered.
So the ship has been refused permission to dock, but there is now work to evacuate 2 people who need care from the ship. Is that a smart thing to do in your assessment, or does it increase the risk of the disease leaving the confines of the vessel?
It's absolutely the right thing to do. You have people that are very sick that need care. And in terms of hantavirus, supportive care is what is needed to be able to have the potential to survive. It has a very high case fatality rate. So the idea is not just to let everybody off the ship when we're still trying to figure out, well, how is this spread? Are these cases connected? What's exactly happening? You've got to let the people off that are sick through a controlled process and get them into the right kind of care under the right circumstances. So that's what they're working on right now.
So let's stick with cruise ships. According to the CDC, there were 23 gastrointestinal outbreaks on cruise ships that called at U.S. ports last year, 18 caused by norovirus. How safe should travelers feel going onto a cruise ship?
I think that travelers should feel very safe going on a cruise. We don't normally think about something like a hantavirus as an issue on a cruise ship. And I think that this is a very unusual situation and a very unfortunate and unusual situation that we're going to investigate and understand a lot more about. But I do think that this is probably very unique and just an unfortunate set of circumstances and timing that occurred. But we're certainly going to learn a lot through this system or through what's happening right now.
So there isn't a treatment or a cure for hantavirus. So what should you do if you do contract it?
Well, the thing about hantavirus is that the symptoms are very similar to influenza or any number of things, and it can take up to 8 weeks post-exposure to start to show symptoms. So the key here really is prevention. If you're going to be sweeping up areas where you have rodent feces and you know that other droppings or urine, you want to make sure that you're wearing a mask. You want to do this in very well ventilated areas if possible. And if you do end up with signs or symptoms that are similar to hantavirus after having potential exposure to rodents, or rodent droppings, then you should definitely let your healthcare provider know.
So the U.S. State Department is watching the situation and ready to provide assistance, but the U.S. terminated its membership with the World Health Organization earlier this year, citing alleged failures during COVID. If this isolated outbreak does grow, are we ready?
Well, here's the thing. I do not think that this is likely to be a widespread issue. I think that this is going to be something that is very specific to this ship. And to these unique circumstances. That said, should we see more cases of something like this, the whole purpose of outbreak investigation is to understand, and we're going to understand a lot more very soon, and we'll certainly be able to take lessons forward. But in terms of the membership in WHO and what this all means, I mean, WHO is really important in terms of coordinating these kind of international responses when you're dealing with all sorts of different players and international waters and all of these other pieces. So WHO will play a very important role in this.
Dr. Ann Ramoin, director of UCLA's Fielding School of Public Health Center for Global Health Security. Thanks for being with us.
Thanks for having me.
Thank you.